I'm Dr. Michael Miyazaki, and if you've ever had a root canal that failed to heal properly, you'll want to hear about this. One of the things that happens when we have a patient that has a root canal, whether we did it or if we referred out to a specialist, is we let that area heal up. And sometimes that periapical tissue just doesn't heal, and we have a constant radiolucency. Sometimes it's symptomatic, sometimes it's not symptomatic. But at some point, we have to tell the patient, you know what, we don't want to let that continue to be there, or it is getting bigger, or maybe we're getting a fistula there, and we need to clean that out so that it doesn't get worse. So what do? Is we have to retreat that root canal. Now, in the past, what we had to do is we had to get the gutta percha out. So when I learned how to do root canals, we used to put a lot of gutta percha in the canals and a little bit of sealer. Why was that? Because the sealer would shrink. So we wanted more gutta percha in the canal than we had sealer. Well, today it's changed a little bit. With the new bioceramic sealers, we don't have that shrinkage. So today what we do is we use a lot of sealer and not as much gutta percha. The gutta percha is a way for us to provide hydraulic pressure to push our sealer laterally and apically. So a lot of times I just use one master point of gutta percha and the rest is sealer, and that sealer will harden without that shrinkage. So when we have this situation where the root canal fails to heal and we have to go in the retreat, I take a rotary file. It's a remover type of rotary file, and I use that to get through the gutta percha, which allows me then to get back down into the canal. But now I have all this ceramic sealer, so what do I do with that? Well, again, in the past, we would use something maybe like chloroform that would be a solvent to help get the gutta percha out, and then maybe it would help to get the some of our sealer out. Today, it's a little bit different. With that hard sealer, it can be very difficult to remove it. So what do we use today? Well, Vista Apex, with its innovation and R&D team, the great chemists that Vista Apex has working there, they've developed Endo Sealer Solvent. And the Endo Sealer Solvent will help you remove your calcium hydroxide if you put some calcium hydroxide in the canal to allow it to heal up a little bit. And it will also help you dissolve and soften up your bioceramic sealers. And so this is a great tool to know about to make your retreatments much easier. Let me just show you how that works. So here's some bioceramic sealer, and I have let this sit here for a week, and I left it out on my desk so you could see that it really dried out. It wouldn't be like this in a tooth that you would have a little bit of moisture. But just to show how this is really, really hard sealer, and what I'm going to do is I'm going to put some Endo Sealer Solvent on here, and what would you do is we would soak this area. You could remove your gutta percha, as we mentioned before, and get that out of the way, and that would then begin to create space for you to irrigate. Now, this isn't going to take effect immediately, so what you do is just give a little bit of time. Squirt it into the canal, let it sit there for about 30 seconds and irrigate it out, and then refresh as you need to. But what you can see is I'm just providing a little gentle agitation, and you can see how this is turning cloudy and how this is beginning to dissolve. So on the left-hand side, we have kind of a control. That's what it looked like before I started to put the sealer solvent in here. And now you can see on the right-hand side how this solvent is just beginning to dissolve away and how it's gotten much smaller. And imagine if you had your files in here and you started to get in here, you could work your files down, and the files would then be able to very easily remove the sealer. Now, one of the critical things with the sealer is this sealer has some acidity to it. So that's the chemistry behind it. So as you're applying this into the canal, you want to be sure that the sealer is not going to affect the canal system or the walls of the tooth, should I say, where it would weaken it. Because remember, in endo, we're trying to clean the inside of the tooth out, the inside, but on the outside part of the tooth, we're trying to conserve tooth structure so that we have good structural integrity once we're done with this retreatment. So now you can see how this is just nicely dissolved, and this is real time. So you could see the volume of sealer that we had in the left-hand well, and on the right-hand side, you could see how relatively little sealer solvent that I've applied, and you can see how cloudy that is because we've just dissolved it away. And as this is dissolving, imagine your files going into that canal system, and all it has to do is just remove this, the fluid, which is now your sealer that's been dissolved. This has been proven to be very gentle to the tooth structure, and that's why this is just not another solvent, some kind of acidic solvent that can break your sealer down. This has been developed with the skill of the R&D team at Vista Apex, who again have developed everything from great irrigants, the Endo Ultra, and a lot of great materials and equipment to help make our root canal procedures much easier. So again, next time you have to retreat a root canal, and again, we hope that with all the new developments, your irrigation, your activation, and everything else that we do, the endo cater, which will help us ensure that we have the canal really clean the way it should be before we obturate it, so that we don't have a root canal that fails to heal, that we're going to be successful the majority of the time. But there could be other things that cause this root canal not to heal up properly. It could be a fracture in the root system. It could be inadequate coronal seal of our restoration that we put over a tooth after it's had a root canal, and maybe we get some bacterial leakage through our obturation and the material that we have sealed this up with. But in any case, look at all those issues, and if you still are having a root canal treatment that is failing to heal, we have the Endo Sealer Solvent from Vista Apex. Check it out. Well, I hope you enjoyed seeing what the Endo Sealer Solvent can do for you in your practice and the retreatment of any root canals that you may have. Remember, if you like this content, hit subscribe and the like button, share with a colleague, because we're building a community of like-minded clinicians that are trying to do the very best for our patients, but enjoy doing it at the same time. So I'll see you again during the next episode. Thanks very much.